Hello, health champions. I'm sure you've heard the expression, don't do drugs. But apparently there are good and bad ones, because some of them are mind-altering and those are illegal, they're banned, they're called street drugs. And then there are those that are habit-forming, like very potent things like opioids and heroin, and those are also illegal. But then on the other hand, if they don't alter the mind, but they alter some other organ function, then they're apparently okay. And if they have toxicity and side effects, then they're still around. If they account for 50% of all the opioid deaths that are due to prescription drugs, then that's still just the cost of doing business. And if these opioids make you 40 times more likely to transition into a heroin addiction, then that doesn't change anything either. They're still okay. And we have over 1 million heroin users in the United States today. The vast majority of those have transitioned from a prescription drug, mostly because the prescription gets you hooked and then they withdraw the prescription, so now people go into the street drugs instead. And here's what really blows my mind is it's still okay to advertise directly to the consumer.
Ask your dermatologist.
Call your doctor.
Talk to your doctor.
Ask your doctor.
Ask your doctor.
That's between you and your doctor.
We can no longer advertise for alcohol or cigarettes. We don't think it's sexy to get drunk and smell like an ashtray anymore, but it's very attractive. It can so enhance your lifestyle by using as many medications as possible. It's only 2 places in the world that this is still okay, and that's the United States and New Zealand. All the other countries in the world have realized that that's probably not a good idea. Because this topic is both sensitive and super important, I urge you to watch the whole video. Because if you watch bits and pieces and you take things out of context, now you will miss the whole intention and the bigger picture of what we're trying to accomplish here. Also, I want to tell you that this is not medical advice. I'm not your medical doctor. That's not the purpose of this. I'm just trying to teach you and show you how the body works and how things interact and give you some solutions, some possibilities. I do not want you to, for any reason, stop any medication that you're taking as a result of watching this video. That's for you and your medical provider to determine. Another reason that you don't want to stop it is that your body gets used to it. Anything you've taken for any length of time, it changes your physiology. Your body downregulates and upregulates. And if you just withdraw it cold turkey, it can have some very unpleasant consequences. What I do want you to do is to start learning as much as you can about the body. Understand if you have a condition, learn where it's coming from. And then if you understand what your body has adapted to get into that condition, now you can reverse that adaptation. You can undo the adaptation, and then most of the time the condition goes away. And then once you have reversed or in the process of reversing it, now you can have a discussion with your medical provider who prescribed this medication, and you can have an intelligent discussion about if and when to change or stop that medication. So I want to use some examples to try to get some points across. And the first one I want to look at is healthcare costs. How much are we spending on healthcare? So since 1970 to 2020, the nominal spending in terms of dollars have increased 50 times. It's gone from 75 billion to almost $4 trillion. And of course, a lot of that is due to inflation, but after we account for inflation, we still have a 7.6 times increase. So in terms of real purchasing power, we are spending 7.6 times more on this healthcare. And if we relate it to gross national product, which is essentially how well a nation is able to afford this healthcare, it has gone from 7% of GNP to almost 20%, 281% increase. So it's becoming a bigger and bigger burden on the national economy and on the individual economy. So every time there's an election, one of the main questions around election time is, how are we going to pay for this? Right? The only question is, how do we bring more people into the system? How do we make sure that a greater percentage of the population can get into the healthcare system, and then because it's so expensive, how do we pay for it? No one is asking the only question that really matters. And the question on my mind is it working? Is anyone getting healthy? If we're spending $11,000, close to $12,000 per person, and they didn't spend any on me, zero was spent on me, so someone got my $11,000, $12,000 as well. With all that money spent, are we getting healthier? Unfortunately, what we're seeing is that the rates of diabetes are going through the roof. Heart disease is increasing, dementia is increasing, autism is completely out of control. At the current trend, it's going to be 1 out of 2 kids shortly. Anxiety is going up, sleep disorders is going up, and the list goes on and on and on. So I'm not trying to judge this as good or bad, but when we call it healthcare, then people should get healthier, right? So whatever we want to call this thing, then we can all agree that with all the money spent and with the poor results, it is not healthcare. The next obvious question then becomes, what is health? According to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. So if disease is the signs and symptoms of a disease, and our healthcare system only addresses signs and symptoms of disease, but it does nothing to bring you closer to a state of physical, mental, and social well-being, then that's another indication that it's not a healthcare system. Unfortunately, most people take health for granted. We pay lip service to it and we say that health is the most important thing there is, but most people don't really appreciate it until it's gone. When we have signs or symptoms, when we're feeling bad, or when something scary happens, that's when people do something. They go to the doctor and the doctor asks, what's the problem? And we tell them our symptoms. But the symptom is not the problem. The thing that is causing the symptom is the problem. So this is pretty much like a car. The instrument panel is giving you feedback on how the car is doing. And if you get a warning light, an indicator, then that's like a symptom. It's the car telling you that something's wrong, something's missing. If you don't change and address this, then it will get worse. And if you have more indicators, more signs and symptoms, now you know that there's more stuff out of balance, and if you don't address it, then the consequences are going to be even worse. So you're driving and you see all these indicators and you feel very uneasy. So you think, I need to do something about this. Now here's the big question. If you simply solve the problem by covering it up, if you put a piece of duct tape over the indicators, if you cover them up, then if you did that 1,000,000 times, or 1,000,000 people did that, how many times would the car get better? Right? Everyone knows the answer is 0. If you ignore the underlying problems, the car will never get better. Then why do we do that with signs and symptoms? Because the same thing applies. When we cover up a sign or a symptom, we allow the underlying problem to get worse. In addition to that, we're also adding toxicity to the body. And we have two marvelous organs in the body, two organ systems, the liver and the kidneys. And their job is to figure out what is valuable to the body, what do we want to keep, and what is a burden on the body, what do we want to try to get rid of. And these organs are so amazing that they have basically 100% success rate in keeping or discarding the stuff that needs to stay or go. So nutrients like minerals and fats, amino acids, glucose, the body is very, very successful. Virtually zero of this gets discarded. It all gets kept. And on the other hand, the things that are foreign, synthetic materials, toxic materials, things that are not beneficial but rather a burden, the body is virtually 100% successful at discarding it. Maybe not on the first turn, but pretty soon after the circulation has gone through these organs a few times, virtually 100% of this is gone. So urea is a waste product. Pesticides are foreign toxic substances. All other sorts of waste that are leftovers, the body gets rid of. And the exact same holds true for medication. It is not of any long-term value to your body. So a percentage of this medication gets discarded every time it passes through the liver, and that's why you have to keep taking more. Now, I know I'm laying it on pretty heavy here, but don't misunderstand this as me saying that medication is all bad. It's all about the timing and the purpose. So there's a benefit versus risk. There's a cost benefit to this. If there's a crisis, if your normal regulatory mechanism, if your physiology has failed, then medication can save a life. If we have extreme depression, that's like a vicious cycle that spirals out of control. And if someone is going to take their life and we can give them a medication and save their life, then that is entirely appropriate. If someone has type 1 diabetes where an organ has failed, the pancreas no longer makes insulin, or if we have surgically removed the thyroid or the pituitary, then we can't make those molecules in the body and they need to be replenished. Very, very appropriate and life-saving. Virtually 100% of people died with type 1 diabetes and now they can live virtually normal lives. If we have acute pain, burn victims, trauma, broken bones, car accidents, pain medication can get you through that crisis. If we have anaphylactic shock, people could die, but a simple shot of epinephrine saves their life. If you have bacterial encephalitis or meningitis, you would most likely be dead within 24 hours without the right antibiotic. So these are cases where it is entirely appropriate, it's life-saving, it's priceless to have the medication available. When we think that just because the medication is so great here, it should be applied to everything, such as lifestyle conditions, now we need to think a little differently. We have the wrong picture of how these things fit together. When the problem is due to a gradual adaptation, when we have a lifestyle that the body adapts to, when we push the body out of balance over a period of years or decades, then the pill is not the solution. The pill isn't going to change anything about the underlying condition. It's not going to bring the body any closer to balance. And the classic example, of course, is metabolic syndrome, syndrome X, insulin resistance. And the extreme sad example is when you have a type 2 diabetic, someone who has already too much insulin, and we give him more insulin because we think the blood sugar is the problem. Well, the blood sugar is the problem because it has too much sugar, so we need to reduce the sugar, not add more insulin. And also in many cases of chronic pain, where the pain is due to inflammation or it has developed over a long period of time. Now, if you give a pain medication, you give short-term relief, but you're not helping restore any function. And most of the time, through conservative care and lifestyle interventions, you can solve the vast majority of chronic pain. I want to ask this question again from my point of view, and this is what I ask patients in the office a lot of times. I ask, what is health? And then I say, health is when everything works the way it's supposed to. And then I ask, the problem that you have presenting with here today, if everything in your body was working perfectly, would you have this problem? And they say, no, of course not. I wouldn't have any symptoms, I wouldn't have this disease, I wouldn't have this pain. If everything was working, then they wouldn't be there. So then I suggest, well, why don't we make it work again? Because if it's the lack of function that's causing the problem, if we can restore the function, then the body should return to health and no symptoms. And this is what happens most of the time, especially if we're patient and we take the time to understand and change. But this is a completely different perspective than medication, because medicine does not add back any function. If something's not working, there is no medication that makes it work better again. It does not restore anything that is degenerated or missing, and it does not actually provide anything the body needs. But then what does medication do? If food supports and provides things that the body needs to create function, then medication actually does the opposite. Medication interferes when we, in our opinion, think that the body is doing something wrong. Then we put in the medication to interfere with what the body is doing. So medication blocks function, it blocks receptors, and in doing that, it either suppresses or increases certain functions. It changes the balance the body is trying to accomplish. It suppresses and it stops physiology. Now, if we're interested in health, wouldn't it be a great question to ask, what is required for health? And I often talk about the triad of health, this triangle where structural and mechanical has to do with the movement that builds the brain. The emotional is about purpose and well-being and peace of mind, because if we don't have this, we can't really be in a healing state. But for the purposes of this video, we're going to talk about the chemical side of this triad, because medication is chemical, it's biochemistry. And how does that fit into the body versus nutrients? The closest most people come to be amazed by the miracle of life is when someone gets pregnant, when they're growing a new life inside them, or when they give birth and they see this new living being that wasn't there before. But think of this baby, which indeed is a miracle. It started with genetic material from two people, it became a cell, and then that cell replicated and grew. Well, that is exactly what's happening inside your body every day. That miracle of life is happening inside you all the time. And why am I saying that? Because you have cell turnover. You have cells breaking down, wearing out, and you make new cells. So this surprises a lot of people. 90% of your cells are new every year. So you go to the doctor and they look at you, they have your picture in the file, they have your social security number and your name, and they treat you, they think of you as the same person, but you're 90% different, right? That's a miracle. And then we want to ask, what are these new cells made of? Where did they come from? Is any part of these new cells consisting of medication? Did medication contribute to build any new cells? And the answer is no, unless there's some toxic residue from some medication that your body didn't get rid of yet. But the medication does not create any of this miracle of life. Instead, what makes that is building blocks that you get from food, from fat and protein. You need fuel to put these building blocks together, and this fuel comes from fat, carbs, and protein. And then you also need some catalysts to convert this fuel into energy and into the building blocks, and these are called vitamins, minerals, and enzymes. These are the things that your body needs. Well, what about side effects? If we take the time to read the fine print, there's pages and pages of unpleasant stuff.
They lower your ability to fight infections. Serious, sometimes fatal events, including infections, tuberculosis, lymphoma, other cancers, nervous system and blood disorders, and allergic reactions.
And we get the impression that if we experience these side effects, which might happen sometimes, then we might get some symptoms, and that would constitute the side effects. So we think that if we're unlucky, then we get symptoms. If we don't, then we're free and clear. But that's not how it works, because by definition, these medications interfere, and they always create interference. You may not notice if you don't have a symptom, but it always interferes. It always blocks physiology. It always, by definition, prevents your body from returning to the balance that it thinks there should be. And in doing that, if we understand that homeostasis is health, then we always have a lesser expression of health with a medication than without. Again, it doesn't mean they're all bad, but we just have to understand when they're appropriate and not. I really hope you can see by now that I'm not saying that it's all good or bad, but it's more about understanding what the body normally does and how medication interacts, so when it's appropriate to use. They absolutely save lives in emergencies. They can absolutely get you through a crisis. If you're a burn victim, if you have broken bones, I would absolutely opt for some painkillers in that situation. They can temporarily provide some value. If you have sky-high blood sugar, metformin isn't always a bad idea, as long as you do something to address the root cause in the meantime. However, while this is super valuable, in my opinion, in my experience, I don't have an exact number, but I would estimate somewhere around 90% of all the prescriptions are for lifestyle conditions. It is used in a way where it's not getting you through a crisis, and we think it solves a problem when a lot of times it actually perpetuates the problem. If you enjoyed this video, I think you really appreciate that one next. Thank you so much for watching. I'll see you next time.
Abdominal pain and yellowing of the skin or eyes.
Rash, hives, swelling of the lips, tongue, or throat, or difficulty breathing or swallowing.
Aggressiveness, agitation, hallucinations or confusion.
Uncontrollable muscle movements, as these could become permanent.
Sudden death, stroke, heart attack, and high blood pressure.